Hey guys, welcome back to my channel. This is Beijing Baby. Well, I read your comment in the last episodes, and some people say that they want to know about our social insurance system. So today, let's start with our key part of our social insurance system, that is our medical insurance system. Many people already know that in the modern national governance, the medical insurance system is one of the most fundamental institutions. In the UK, there is NHS. In the United States, healthcare is highly market-oriented, with very advanced technology and a wide range of treatment options. But this year, there is a huge change in the Chinese medical insurance system. First, it is the so-called the second payment system. And this system does not care about how serious your illness is. It only cares about how much patients with your kind of illness are allowed to cost on average. Once your treatment expenses exceed that quota, medical insurance stops paying. The hospital will no longer provide low-cost and effective treatment options for you. Second is the centralized purchase of the drugs and the medical devices. And the target is very clear. It's trying to lower the price of the original branded drugs and imported medicines to the lowest. And what is left behind is the substitutes with the lowest price. But for this kind of medicines or equipment, they can only maintain the current condition instead of curing you. When these two brand new systems combined, the result can be very clear. The chronic illness and age-related diseases cannot be actually cured inside this kind of medical insurance system. Let's look at a very basic fact from the China's National Bureau of Statistics. The current number of people enrolled in the basic medical insurance system has reached approximately 1.33 million. There is really 1.4 billion people in China. That means about 95% to 98% people have been enrolled in this universal medical insurance system. As long as you are in China, whether you use this medical insurance or not, whether you pay completely by yourself or you pay by a commercial medical insurance, as long as you go to a hospital that is part of the medical insurance system, your treatment expenses are still counted within the insurance systems. What does this mean? This means that even if you pay by your medical insurance, it still be counted by the hospital, and thus creating a pressure on the hospitals for the exceeding cost limits according to the second system. So for most of our ordinary patients in China, the only way can escape from this kind of system are only three ways: foreign-funded hospital, high-end private hospital, and hospital for high-ranking officials. And these places are only belong to a very small group of people with power or significant wealth. By the end of last year, China's population aged over 60 and above was close to 300 billion. Elderly people is considered as fragile population, since for them, the flu is not a simple cold. People really do die. And let's look at the chronic disease. According to the data from the health statistics, by the end of 2024, the patients with the chronic disease has over about 500 million. That is to say, over half of the people aged over 60 or above suffered from the chronic disease. This kind of disease include heart disease, hypertension, diabetes, liver cirrhosis. Here comes the problem. When the second payment system combined with the centralized purchase of the drugs and devices, and these two systems come into effect, those 500 million people with chronic disease, they just cannot use effective import drugs and original brand drugs. If you want to receive the real effective medical treatment, the only way is to go to the hospital that is not part of the medical insurance system and pay all by yourself. People may ask, is the commercial medical insurance the way out? I'm so sorry, this door has already been closed. This is because they spend most of their time receiving treatment in the public hospital, and they have a clear documented record of their disease. If they try to purchase insurance now, they are either rejected outright or face premiums that simply unaffordable. Under this current direction of the policy, a large number of aged patients without rights or significant wealth are pushed to a dead end by the system. And that is why so many people cannot figure it out. Why did I pay the medical insurance for decades, only end up with a serious illness and nothing left to do? But wait, if you're still interested about the China's social insurance system, leave a comment. I'll tell you more about the Inside China next time. See you!